About 50% of the offices and dental offices in the United States now have digital radiography. So it is definitely catching on. It's not something new. We get to do a lot of things with it. We get to enhance the images. We get to make the images larger. I know for myself, when somebody sends me these small little films now, the standard number 2 size films, I can barely read them. I no longer am used to reading them. I have a 22, 26-inch monitor in my operatory. We are making these things huge. I have the ability to enhance the images, change some of the settings so it's easier to see caries. It's easier to diagnose periodontal disease. It's easier to explain it to the patient. Again, I mean, we did this in the past where we'd hold up this nice little film to a patient, and the patient shook their head, and maybe they agreed, maybe they saw, oh, what's that at the end of the apex? You know what? For the most part, they didn't. And all the excuses now about, well, the cost and everything else, I will tell you, I was a latecomer to digital radiography because of it. It was a mistake. I started with phosphor plates. I've since moved on to also using sensors in my office. And something like this Sopix2 sensor really makes it simple. Acteon has to put hardware technology into the Sopix2 sensor, which will limit the amount of X-rays accepted, radiation accepted by the sensor. So you can't overexpose it. I mean, think about all these new technologies. You can't overexpose this no matter what you try and do. And there's also part of their software where it tells you, are you in the sweet spot for, shooting these radiographs with the sensor? So, again, trying to minimize the amount of radiation that you're going to expose the patient to. And we all know, in this day and age, we want to keep that to a minimum. So it's really something to think about. We talk about going green and less chemicals and all the other things, but if you don't have digital radiography, the first time you watch the patient's face, when those images start popping up on the screen, it will totally convince you that you made the right decision. I could never imagine going backwards. We are able to do so many things with these images. Instant access, easy to send them. I mean, one of the jobs in the office that nobody likes is duplicating radiographs. Now it's as simple as sending them out. It can be done various different ways, HIPAA compliant, of course, and it doesn't take a lot of effort, and it's done immediately by somebody in my office, not something that's piled up for a while till we get enough to force somebody into a dark room to do it. So you really should be looking, if you're not using digital radiography, you should be absolutely looking at it as something that should be part of your practice because it is a big enhancement to your practice.